Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us once again for Health Professional Radio. We'll be speaking with Dr. Joe Kimura. He's joining us here as Chief Medical Officer at Somatus to discuss how his company deployed a robust transitions of care, or TOC service, to help their patients safely transition from acute inpatient care to home. Welcome to Health Professional Radio, Dr. Kimura. Thank you so much for joining us.
Thank you for having me, Neil. Pleasure to be here.
Give us a bit of information about yourself. What is it that you do, and where do you do it?
Sure. No, absolutely. So I serve as Chief Medical Officer for Somatus. As you said, we're a value-based care kidney company based here in McLean, Virginia. Clinically, I'm a primary care doc. I'm boarded in both internal medicine and in clinical informatics. And I've spent a good part of the past 2 decades clinically administratively actually working in value-based care settings. I joined Somatus about 1.5 years ago, and prior to that, I spent 7 years as the Chief Medical Officer for Atrius Health, 1,100 physician group, value-based group in Boston, Massachusetts. It's the old physician side of the Harvard Community Health Plan. And Somatus is actually one of the nation's first and largest value-based kidney care companies. And we serve about 160,000 patients across 36 states in this country. And what we do is we deploy a really robust population health model that includes social workers, community health workers, nutritionists, pharmacists, and nurses who work in line and in conjunction with community-based providers, both PCPs, nephrologists, and other specialists, to make sure that we're doing everything we can to help prevent the consequences of unmanaged chronic kidney disease out there. And there's a lot of folks, 1 in 7 patients, that have some form of chronic kidney disease in the United States. And we're doing our best to try to make sure that we do what we can, right, to prevent everything that, all the complications that come from kidney disease when it's not treated well.
Kidney disease and end-stage kidney disease. You deal in both of those areas, correct?
That is correct.
TOC, this transitions of care. What is transition of care service, first of all, and how does it benefit these acute patients?
So it's a great question, Neil. So transitions of care is kind of a set of activities that we realized, we being sort of healthcare in general realized, could really help a patient as they're coming from an acute inpatient hospitalization back into the home-based setting. As you might imagine, any patient that's come out of the hospital for an acute incident that's trying to make it back safely into the home, there's a whole myriad of things that make that super, super difficult, not only for the patient, but for their caregivers as well. If you really take a step back and you think about the controlled environment of a hospital, right, where you're in your bed, you're in your room, you have nurses attending on you, watching everything from the meals that you eat to the medications that you take to the activities that you do, to home, right, where essentially you and your family or your caregivers are the ones trying to do everything that you need to do to stay on a healthy track. And that transition from acute inpatient to the outpatient or home setting has been noted as a particularly challenging time. That's evidenced by the fact that a large proportion, probably 1 in 3 in many areas, patients actually end up having to return to the hospital because something went wrong when they left the hospital. And we're talking about returning to the hospital sometimes within days of being discharged. We know that this transition is super hard. It's challenging for everybody. And so transitions of care has been developed as a set of interventions that we can do in healthcare and with working with patients and their caregivers to be sure that everything that needs to happen, from medication management to proper follow-up to being sure that the home environment is safe for a patient, gets done within a very timely manner, usually within sort of 24 hours to 7 days, to make sure that, again, patients have, quote, safely returned back from an inpatient setting to a home-based setting. Transitions of care is something that a lot of organizations do across the country. It probably was developed or monikered maybe about 20, 25 years ago or so. So there's a well-established set of things that we know can work. The challenge of doing good transitions of care, Neil, is execution, right? How can we make sure that patients get these kinds of well-known, effective treatments in the days after they come out of the hospital. And that's the trick that, again, Somatus has been really focused on to try to make sure we're working in conjunction with providers and patients to be sure that patients are as safe as possible.
How different are the TOC services for an end-stage patient as opposed to a chronic patient?
Great question. I think in many senses, the distinction for an end-stage patient, not just from a general clinical sickness perspective, so many patients with end-stage kidney disease have pretty significant vascular conditions, cardiovascular conditions, and other conditions that put them at risk. But probably the thing that comes most to mind, right, is their need to be on dialysis. And so one of the most important things, and probably, unfortunately, one of the things that drive a fair amount of readmissions, is when a patient exits the hospital, they really do need to make it to their next dialysis appointment in a timely fashion. And if they miss that appointment for a multitude of reasons, whether or not there's not transportation, whether or not the appointment wasn't made, or sometimes actually the patient just feels crummy and doesn't feel like going to that appointment, those kinds of things actually lead to pretty quickly the patient's care deteriorating and the patient needing to return to the hospital. So ESKD, or end-stage kidney patients, definitely require a higher level of sort of touch and as well as attention to be sure that we've sort of dotted our I's and crossed our T's as best that we can.
When it comes to these patients, what is the main challenge when something goes wrong at home, as you mentioned before? Is it normally a compliance issue? Is it normally a equipment issue? What are these patients normally dealing with that sends them back to the hospital so quickly?
Yeah, it's another great question, Neil. I think in the primary care and the medical parlance, I think we've steadily shifted away from thinking about compliance as something that patients need to do towards a more collaborative term, right, that says adherence. Like, let's try to work together such that a patient can stay adherent to what the care plan is actually designed to do. And I think one of the most critical things, and this is hard to do, as you might imagine, is be sure that we're maintaining the right medication. So let me set this up for you. So when you're an end-stage kidney patient or a late-stage CKD patient, you're probably taking a fair amount of medications to try to keep you as healthy as possible. But when you're admitted to the hospital, it could be for something related to your kidneys. It could be something completely unrelated, say pneumonia or some sort of other kinds of infectious process. At that point in time in the hospital, much of your medication regimen actually gets changed, altered, and shifted. Again, because you're in such a high monitored situation, the doctors and the nurses in the hospital can make those kinds of changes safely and be sure that you're, again, put on the right path in terms of getting healthy. But those medications are probably not the right medications to be on when you're actually left the hospital. You need to somehow make it back into your outpatient regimen. And that transition is where a lot of medication errors happen. And this is where one of the things that Somatus does really well, it's not just what the hospital discharges the patient on in medications and what the outpatient or the primary care doctor and the nephrologist has placed the patient on. You have a third element that makes this complex. That's usually the medications that are sitting in the patient's medicine cabinet. So when a patient comes home with a bag of medications that the hospital has given them, they come back and they say, okay, so here's the medications that my primary care doc and nephrologist had given me, but oh, wait a second, there's similar looking medication that's left over here in my medicine cabinet. Which one should I be taking? And as you know, and many of our listeners probably know, many of these medications actually are the same medication that are labeled differently, right, because of different brand names and different kinds of formulations, at which point the risk is patients end up taking either too much, too little, or started on the wrong set of medications, which inevitably, if not picked up soon enough, leads to complications that, again, leads to patients feeling bad and having to return to the hospital. Medication cleanup is probably one of the biggest things that we could work on.
I'd like to remind our listeners that patients with kidney disease who received help from Somatus when transitioning back home after a hospital stay, it's my understanding that they were about 49% less likely to be readmitted to the hospital compared to those patients that didn't receive this care. Can you expand on that and then give us a website where we can learn more?
Yeah, so thank you so much, Neil. So yes, so we took a look historically at seeing our patients that actually had this transition of care type service provided versus patients who were not able to partake in the service. And those who actually received the service were 49% less likely to be readmitted for all the reasons we articulated above. And in many cases, this is not just for patients with end-stage disease, but for patients with CKD 3, 4, and 5. And this was an evaluation study done by the Validation Institute that you're referencing that we recently put out overall. If you want more information about Somatus, simply going to www.somatus.com will provide a linkage into all the resources, whether you're a provider interested in helping your patients get better preventive care with the set of services that we provide, or patients who are really looking to figure out how can I augment what we're doing today to be sure my kidneys stay as healthy as possible.
Dr. Kimura, I appreciate your time this morning. Thank you so much for joining us here on Health Professional Radio, hoping that you'll return.
Absolutely, Neil. It's a pleasure speaking with everyone today, and thank you so much for the invitation.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Joe Kimura. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.